President Trump says he is going to follow through on his threat to suspend funding to the World Health Organization in the middle of this pandemic. The president says the money will be withheld pending an investigation. As criticism has swirled around his own administration's handling of the crisis, he has suggested that the WHO should have done more to warn the United States.
Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground and to call out China's lack of transparency, the outbreak could have been contained at its source with very little death.
The U.S. gave the Geneva-based organization more than $450 million last year. That's according to the Associated Press. The group's mission is to fight diseases, ensure patients get health care they need, and prevent outbreaks. Anthony?
Joining us now from Washington is the director of the Centers for Disease Control and Prevention, Dr. Robert Redfield. Dr. Redfield, good morning, and thank you for being with us.
Thanks for having me, Anthony.
I want to get to the president's decision about cutting funding for the WHO in a moment, but I want to start with this framework for reopening the country, which the Washington Post reports that the CDC and FEMA have been working on for the past week, that involves the lifting of all mitigation over a period of 180 days. How long before this report is finalized, and what guidance exactly have you been giving the president?
Well, CDC has been involved from the beginning in giving both science and data to help advise policies on this outbreak response. And obviously, I'm an active member of the White House task force. We continue, CDC, to provide our perspectives in terms of consideration as the task force as a group is looking at all the different options for our plan to begin to help assist the states as they begin to reopen our country. We're poised to provide assistance. It's going to be really important to get a few things in place, more obviously testing for early diagnostics, expand the public health capacity for early diagnosis, isolation, and contact tracing. This is going to be fundamental to maintain and contain cases as they occur, and then make sure we have the health capacity to deal with this as we work to regain the confidence of the American public that it's safe to go back to work.
How do you see that process working out? Your predecessor, one of your predecessors, Dr. Tom Frieden, has said in terms of contact tracing, we could need essentially an army of healthcare workers as big as 300,000 people. We're obviously nowhere close to that. We're also behind in testing. How long before we're ready to begin this process?
Well, I think we're continuing to improve the availability of testing every day at the level of the states, and that's going to continue. I think expanding the public health workforce so that we have more individuals, boots on the ground in the field, so that when a case is identified, you can do very rapid, comprehensive contact tracing. We're in the process of augmenting that. We've also provided substantial resources to the states, so they're going to begin to augment that capacity. And I think we'll have a collective expansion of boots on the ground. Ultimately, what the ultimate number is that's going to be required, I think, is still speculative, but we're prepared to move that forward and improve that, local public health capacity so people are diagnosed rapidly, and when they are, they're isolated and the contacts are traced, and then they're diagnosed, and then they're isolated, and then their contacts are traced. That's going to be fundamental. This outbreak got beyond containment this time. We need to get it back, so the containment's an important part of our overall strategy that then will be supported by some targeted mitigation.
There is one study that's reporting that we may not be able to ease social distancing if we don't get a vaccine until 2022. Do you see that being a possibility?
I think mitigation steps that we've done are going to be an important component of it. I think it's really a moment to take a bow for the American public that really embraced the social distancing recommendations that we put forward. I think when you saw the original models that I had to see from CDC that modeled up to 2.2 million people dying before the fall, it was potentially catastrophic, as you can see. Obviously, the 26,000 lives lost is 26,000 too many. But that said, it really is the American public's response to social distance and sacrifice, not for themselves, but for the benefit of the most vulnerable, it's really a testament. I do think we're going to have some social distancing that's going to be a critical part of our strategy as we go forward while we await the fruits of the innovation of the different biological countermeasures to include a vaccine.
On the topic of the World Health Organization and the president cutting off funding, Bill Gates said overnight, in his words, that is as dangerous as it sounds. You've called the WHO an important partner. Do you view cutting off funding to them as dangerous?
You know, I'm just going to say that WHO's been a long-standing partner for CDC. We've worked together to fight health crisis all around the world. We continue to do that. We're working side by side now in the Congo, in the DRC, with trying to bring the Ebola outbreak to an end. We're working obviously together on this coronavirus. I think it's important at this point that we leave the analysis of what could have been done better and what maybe we did well to once we get through this and get through the outbreak, we get it over. I think.
But Dr. Redfield, if you cut off funding to the WHO, and this is a significant amount of their funding in the middle of a pandemic, what's the impact internationally to fighting this virus?
Again, I'm going to come back that WHO has been a long-term and still is a great partner for us. We're going to continue to do all we can together to try to limit this. Those decisions that are going to be made above related to some of the geopolitical issues, I have to leave to those that really have that expertise. But for me and for CDC in the public health arena, we're continuing to work side by side with WHO to do the best that we can to limit the spread of disease and to protect the American people.
All right, Dr. Redfield, that's not really telling me how much damage you think this is going to do, but thank you very much.